Hi.
Why do people keep re-spraining their ankles?
So once people sprain, there can be a little inflammation and micro tear in their muscle and tendon and the ligaments. When you see this anatomy, this is a fibula bone, and then there's a muscle called the Peroneus muscle. It goes up to from the fibula bone head, going all the way up to here. Tendon is going attached on your ankle. So when people sprain, that's usually going inwards. Inversion sprain, then that causes a little micro trauma on the ligament, tendon, and then muscle too. After the recovering, people usually do massage and treatment over there, this area very often, the ligament area, tendon area. But one of the reasons people keep re-spraining is they don't treat the muscle over there. So main muscle prevent going the inversion sprain is this Peroneus muscle. This muscle does the eversion, opposite side. So we gotta treat this muscle to prevent further re-sprain. People will overlook this muscle. So today I'm gonna show you how to treat this muscle. Release the Peroneus muscle. You gotta understand the anatomy. So Peroneus muscle start from the fibula head, going down all the way to the ankle. And then when this muscle getting tight, it creating a little trigger point, muscle knot, in this area and then this area. But we're gonna search. We can search ourselves using the ball. We can figure out where it's more sensitive and trigger point. I'm gonna show you right now. Peroneus muscle starts from this bone here. You can see this a little prominent bone here, right? This is a fibula bone. It starts from here, it goes down like this, and then it goes all the way up to here, and then it goes this way. You can see the tendon here. When it eversion, you can see that this tendon goes down here. So we're gonna treat this muscle using the ball. People can be sensitive, then use the soft ball, like a tennis ball. And then later on, we can use the trigger point ball. And then lacrosse is the funnest ball, so you can use that. First of all, you gotta put the ball and then you gotta massage following these fibers. We're gonna start from the upper fiber and then we're gonna go middle and the lower. So put the ball approximately around this area, the upper part. And then you're gonna position like this, and then you're gonna put your elbow and then put some pressure on it. And then hold it like this. Your elbow, right elbow here, and the left, hold your foot, and then make it a little stable. A little leaning on it, and then you can go up and down. You can go a little side to side, up and down. And find a little sensitive spot. You can stay a little bit until you feel a little release, like 20-30 seconds, and then move a little up and down. And then when you find a very sensitive spot, that's usually trigger point, then you stay there with a proper amount and then stay there. Let's say you focus on the upper fiber and then you feel less sensitive, that means the muscles are a little released. And then go down a little bit, middle fiber, same thing. And then arrange the ball and then put your body weight over there, a little lean on it, use your elbow, body weight leaning on it, and then make it stable, and then you up and down. So main trigger point is, one is around this area, and another one is gonna be a little this area. So a little search, but you're gonna search it and you find out where is sensitive spot and you stay over there 10 to 20 seconds, and then several times repeat until you feel less sensitive. Less sensitive, then it's a little release, and then go find another spot. So you're gonna release upper part, middle part, lower part, yeah. After that, I'm gonna show you some exercise. I'm gonna introduce you two exercises for ankle stability. First one is very simple, just a single leg stance, and make a little arch, make a little arch and hold the ground. Use your toes a little, hold the ground, and then single leg stance. Once you get better single leg stance, you can start adding a little trunk rotation. Just slowly rotate as long as you can hold the balance. And then keep using your arch and then foot muscle. The front side, yeah. 10 times each side. Yeah, this is second exercise, we're going to use the theta band, tie like this, and then wrapping around your ankle. Okay. So Peroneus muscle is doing the eversion. So we're going to do eversion exercise. Use the opposite side, anchor with the band, and then you're doing the eversion, and then slowly come back. 3, 2, 1. Yeah. Ankle eversion. Yeah. 3, 2, 1. Yeah. Ankle eversion. Yeah. And then feel the outside muscle, and then 3, 2, 1. Yeah, ankle eversion. 3, 2, 1. Yeah. And then coming back, slowly coming back. That's called eccentric. It's good for the muscle recovery. So if you have suffering from chronic ankle sprain, try this one. don't overload the muscle. Try with this muscle release and reactivation, and then let me know how it goes.